Hi, I'm Saba with the Medica Zone. Thank you so much for taking time out of your busy schedule to come and volunteer your expertise for us. So first and foremost, would you please introduce yourself um, on the personal and professional level, if you would like?
Sure. So, hi, Saba. Thank you for having me. So, my name is Dr. Katie Deming. I am a radiation oncologist. So, I trained in radiation oncology and then practiced for 20 years. I also am a former healthcare leader. So, running end to end care for cancer care. So, from screening, prevention, diagnosis, treatment into end of life or survivorship. So I did that as part of my conventional medicine career. I'm also an inventor and entrepreneur. So I had a line of bras for women with sensitive skin from radiation therapy. So I invented that product and had that line for probably 6 years before I closed that down. And in 2020, I had an event that is similar to a near death experience, but it's called a shared death experience and actually can happen to healthcare providers who are at the scene where someone dies and they have a metaphysical experience, a lot like a near death experience. And I had that happen to me in 2020. And after that event, a lot like after a near death experience, it really changed me and it made me see some things about what we were doing in Western medicine and specifically oncology that was not true healing and has led me out of that space. So I retired from conventional medicine and I now run an integrative practice that I call conscious oncology.
Yeah, so we're actually very interested in your versatility. I love that you've been a TEDx speaker, you have a podcast, and you've been even an inventor. And so we wanted to kind of dive deeper into the conscious oncology campaign that you mentioned. And so I want to ask if you could explain what conscious oncology means to you and how it differs from traditional oncology.
Sure. Well, the reason why I call my practice conscious oncology is because it puts consciousness at the center of healing, and it's really a holistic approach. So, holistic means, or healing actually, the definition of healing means to bring wholeness to the person or the being. And basically, my approach is the same. It's holistic and it focuses on not just physical healing, which is what Western medicine focuses on, but it also addresses emotional healing, the power of mind in healing, and also spiritual alignment and the importance of when I say spirituality, it doesn't necessarily mean someone's faith. It's more about them being aligned with who they are authentically. So my practice encompasses all of those areas, but I don't believe that any one of those things is the cure for cancer. I really think that it's in bringing all of those areas together is what allows the person to access their own healing. I actually think that we are our own healers, all of us, and that I don't heal anyone else. I help facilitate healing within the person. And so my method, the conscious healing method, is really there are 4 steps in conscious healing. The first is we need to calm the nervous system. So help people bring them out of a fight or flight state into parasympathetic and calm, because we can't heal when we're in fear. And as you can imagine, with a diagnosis like cancer, people are immediately in a fear state. So the first thing that we do is calm the nervous system. The second thing is we detox the body and also detox um, toxic emotions, also past trauma and toxic thoughts that maybe have been conditioned into us. And then the third thing is nourishment. So, you know, most of us in modern society are not getting the nourishment that our bodies need, and not just physically. So this includes the food and water that we drink, but it also includes the connection and emotional health and getting the nourishment that we need from the sun and the earth and connection to nature. And then the fourth thing is alignment. So aligning ourselves with who we are authentically, not who we've been conditioned to become by our family or schooling or career, that kind of thing. So my approach really is these steps allow someone to get back into the way their bodies were designed, because I truly believe, as the name of my podcast states, we're born to heal. Like, we don't think twice when we cut our finger, right? It just heals, and we don't even think about it because we've cut our fingers, hundreds of times and just watched it heal. But what people don't know is cancer, we also can heal cancer, and that everyone in their lifetime has had cancer cells in their body, but we don't all develop cancer. And the reason is because we have either too much toxicity in the body, or we're not getting the nourishment that we need. And so if we're able to detoxify the body and nourish it with what we need, calm the nervous system and help people get aligned, healing is the natural result of that. And that's really what I'm helping people achieve, is how do we activate the body to do what it already knows how to do, which is heal.
Yeah, so I think your approach is absolutely amazing. It's very unique in how personal it is, and that sort of brings up the question of how would you balance empathy with maintaining a professional emotional distance when dealing with patients with cancer, especially considering the weight of your field and of oncology. And I know you have like one-on-one services as well, and so I can see how those lines might start to blur and it can be a very emotional job. And so, how do you sort of balance and deal with that?
Well, I mean, actually, a lot of my practice is teaching people how to become fluent with their own emotions. And so before I could do this work effectively, I had to learn how to become fluent with my own emotions. And so learning how to process my emotions and let them run through me and not get caught in them is a big part of that. Like, we can't give other people what we don't have. And so if I'm teaching these things to my clients, it's important that I have those things within myself. But I'll bring your question to like the conventional medicine space, because I think for most of your listeners are medical students. Is that right? Yeah,
Yeah.
okay. So thinking about this in terms of like a traditional career in medicine is, we're taught to have these professional boundaries so that we can protect ourselves. And the truth is that part of the healing that happens between a physician and a patient, or a nurse and a patient, or anyone who is helping someone, is that connection, emotional connection, is actually an important part of the healing. And so I would say part of what we are doing is not just the physical, it's actually this connection, and that our patients know when we truly care about them. And we never want to get rid of that. We never want to lose that and become cold or disconnected with what they're going through. But at the same time, we have a job to do, right? So we need to be able to do our job while emotionally connecting with this other person. And I will say that this is something that is learned through experience and not something that will come natural to people initially. And I think accepting that you're going to just learn by doing, and you're going to develop your own natural style. Because for me, when I first started practicing, I really did become very close to many of my patients. And I started to see how it was skewing my view of the world. Like, I thought that it was normal. I collected a lot of young women with breast cancer who were young moms and had small children. And I thought for a period, I'm like, it's normal for mothers to get cancer and leave their children. And I started to get really kind of skewed, and I realized, like, oh, what's happening is that I'm becoming too close to this situation. Not that I was too close to my patients, because I feel like our patients need us to connect with them in that way. But what I needed to do was I needed to develop some balance and some perspective to realize that this was not the whole world. And actually, medical students experience this, and that they start having, symptoms of things that they read about or they learn about. And this is part of just getting used to being around people who are sick. And I think for me, the biggest thing was I never wanted to lose that authentic connection, and that my patients felt like I love my patients. Like that is something that I always want them to feel. But then I also wanted to have grounding for myself so that I didn't get caught up in their um, grief and their sadness. So I had to develop practices for myself. So, I grieved. If I lost a patient, I allowed myself to grieve. And I think in medical school now we talk more about that, but they didn't actually when I was a medical student, we didn't talk about that. But being able to process that, having, practices that before I go into the room of a patient, and now I see people virtually, but before what I would do is right when I was going to go into the room of a patient, before I, turned that doorknob and walked in, I was like, okay, I am here for them, and I'm dropping everything that's going on with me, and I'm going to be here with them. And then when I walk out of the room, I again say, I'm letting it all wash off me. It's like I'm dropping it because I've got to go right into the next room. And, especially in oncology, I would have, like, I remember one day I was in clinic and I was, seeing a patient, but one of my other patients just had a scan that had bad results, and she was in my office, and I knew I didn't order the scan, one of her other doctors did, and they were likely going to call her on the phone and give her the results on the phone. And I was like, well, she's here, I would rather have her get it from me. But I was doing another consult, and so I had literally like 3 minutes while one of my client patients was getting dressed for a gynecologic exam. I had my nurses put this other patient in a room. And so I had to pop in and tell this patient that she had metastatic disease that had spread to her brain, and give that conversation in, 5 minutes, and then immediately walk out and go in and do an exam. And this is just the life, right? This is what happens. But so for me, I clear myself before I walk in the room. I clear myself when I walk out of the room so that I can be fresh for the next person. But then, as you can imagine, at the end of the day, not only are you mentally exhausted, but you're also emotionally exhausted from work like this. And so having practices that refuel myself was important. So I would do meditation. I would also make sure that I exercise. So all of the self-care stuff that we're taught to do are really important when you're in a specialty that is highly emotional and, can be very sad.
Yeah, that's definitely it can be pretty morbid, especially when there starts to mix this education and professionalism with patient to patient relations. But I think it is, like you said, very important that you do maintain those relations and you have some connection to them. So we would also be interested in sort of on a more personal note, hearing about what your patients have taught you over the years about maybe life resilience and healing that has sort of shaped your approach as both a doctor and as an individual. If there are any like really standout experiences with certain patients that you want
Yeah,
to talk about.
sure. Well, I think so. One of the experiences that I had with a patient that made me start to realize the power of our mind in healing was a woman that I had treated for head and neck cancer. And she had, like, I forget whether it was a base of tongue or tonsillar cancer. And basically the treatment for that, the chemo and the radiation for it, is worse than the disease. So it makes people very, very sick. And, the consult is like 90 minutes because the complications of the treatment are so intense that you need that much time just to have a full discussion. And I remember explaining to her the treatment and then the side effects and all of that. And she said, I know, Dr. Deming, that you think that I'm going to have all these side effects, but I just need you to know that's not going to be me. Like, I trust in God, and that's not happening. That's not going to be my story. And I was like, oh, how sweet that she thinks she's not going to experience that. But I know, because I had treated, at that point, hundreds of patients, and was, I knew I had seen it over and over again. But sure enough, She completely defied all of the expectations that I had. She did not, she developed side effects, but she developed them later than I would have expected, and they were less severe. And she didn't lose the amount of weight that I had expected, and she didn't require the same amount of pain medications. And, at the end of it, she said to me, Dr. Deming, I told you I wasn't going to have those same side effects, and I didn't have them. Like, I didn't have what you expected me to have. And I said, you're absolutely right. And after that, I realized that what our patients believe about what's going to happen to them is really, really important. And this is actually something, when you think about the PARQ conversation. And I don't know if as medical students, you guys, are taught that language, but basically when you're charting and you're doing your assessment and plan, if you're describing that you had a conversation with the patient about the procedure, the alternatives, the risks, and the potential complications associated with that, that's a PARQ conversation. And basically, you're documenting that you got informed consent to have them do this treatment. What happens when we give them that whole laundry list of potential side effects of the treatment and the potential complications is we are actually putting in their mind all of these negative things that can happen. And one of the things, when I started to recognize the power of the mind, I started to really get concerned about these conversations that we have where we have to go through this laundry list. It's like, I wish that we could do that and then erase it from their mind, because they need to know the potential complications to be able to consent to the treatment. But then after that, it's like that now has been seated in their mind. And if they believe, because you are an authority figure as a doctor, telling them that these things could happen to them, then they're more likely to happen. This is the placebo effect, right? We're not taught this in medical school. We're taught the placebo effect from the perspective of, testing a new drug, right? We test it against maybe a placebo. But what they don't tell you in medical school is that 30% of the people who take the placebo have an effect, right? Up to 30% of people who take a sugar pill have the desired effect. And it's because they believe that it's going to work. And so for me, like, as I realized the power of the mind, number one, I realized what I believed and what I imparted to the patient about what's possible for their healing is really important. So the things that you bring into your visits with patients, and having confidence in the ability to help them and make them better, is really important. But then also, what negative things you say to them are also really important. And of course, you have to have these conversations, but then I always would soften after I had these conversations. We just went through this list of things that could happen for you, and it's important for you to know that. But what I want you to do is to let all of that go. And it's really important to imagine that you are going to do very well with this treatment, and that you can program your mind to have a better outcome than what is the typical expected results. And so in my current practice, I use techniques like that, like subconscious programming, hypnosis, Psych-K, different techniques to help them program their subconscious mind to get the results that they want.
So I know that you've sort of made your own campaign for it, and you've had your own initiatives, and you've worked towards this vision that you have of the medical system. So obviously, there are a lot of maybe almost inadequacies in the educational system for the medical field. So also, outside of just delivering the news, are there any other ways that you think that the educational system can more adequately prepare medical students for actual patient treatment and patient to doctor sort of interactions?
Well, so number one is nutrition. In medical school, it's not mandatory to teach about proper nutrition. And so most doctors who come out are inadequately prepared to help patients heal using nutrition, which absolutely is a foundation of healing. And I think that it's frankly embarrassing that medical schools don't incorporate nutrition, or if they do, it's very superficial, but we don't talk about metabolic disease. And, we're seeing astronomical rises in diabetes, obesity, neurodegenerative disease, cancer, and all of that is related to metabolic disease. And so that would be my first recommendation for any medical student is if you don't have nutrition as part of your curriculum, and also if you do have nutrition, I'd be so curious to see what is being taught, because there's a lot of different avenues, and I would say not all of them are correct, but basically whole foods, reducing processed foods or eliminating processed foods from your diet, eliminating sugar, eating healthy meats that have been raised humanely. This is what we're designed to eat. I would say that is the biggest downfall of the education system. But I also really believe this is true, that the system works exactly as it was designed. And this is like upsetting for me to say, because I, like you guys, was conditioned into this same system. The system is designed to prescribe pharmaceuticals, to sell pharmaceuticals. If you teach people how to heal themselves using diet, that system doesn't make any money. And so for me, for young medical students who are interested in really helping patients, number one is you got to learn about nutrition. You got to find that on your own if you're not being taught it. And then the second thing is you have to understand that emotions are tied to illness. And this is not taught in medical school. And it wasn't until I left and I, basically, or when after I had that shared death experience and I started to look at like, well, what is going on? Why is what we're doing, not correct? One of the things that came in very strong was the connection between emotional illness or emotional trauma and illness. So there's a study called the ACE study. All of you should be aware of this. It's the Adverse Childhood Events study. It's a longitudinal study that followed children who had adverse childhood events, which are defined as could be physical abuse, could be sexual abuse, could be neglect, could be parents who had a divorce, could be a parent who's addicted or incarcerated. There are a whole bunch of things that are traumatic as children, for children, and they called those adverse childhood events. What they found was the higher the ACE score, so the higher the number of these emotionally traumatic events for the child, the higher the incidence of cancer, diabetes, cardiovascular disease, lung disease. And I was never taught this. And this is so important because for you guys to understand that emotional trauma plays a role in the development of illness is really important, because we totally disregard that. And then the other thing is in cancer specifically, if trauma is related to the development of illness, and then you think about the emotional trauma of getting a diagnosis of cancer and all the fear and everything that is perpetrated with that, we've then just inflicted more emotional trauma on people, which is potentially going to make them sick. So for me, I think the two things are understanding diet and then also really starting to understand the role that emotions play in the health of our physical body.
Yeah, of course. There was also just one point that I was really interested in. I loved how you brought up sort of the conflict within the medical system of being lucrative and actually being educationally enriching for its students so that they can consider things like diet and other outside factors. Because obviously, when you get into the real world, there are all these other factors that you're not going to find them in a textbook. And so I was interested in how people have responded to your shift in ideology and approach because like you said, the medical career, a lot of people go after it for a secure job. So I know that it obviously has probably changed your life in a lot of factors. So I was just interested in how that has worked out for you and how you've been able to overcome it.
Yeah. Well, I think this idea, I think that as an individual, your degree holds power. So when you finish your medical education, your MD holds power in those credentials, and you don't have to do things the way that the system is designed to do them, but it requires you to get creative, right, and work outside those bounds. I will say for me, my transition out of Western medicine was a rough one. I gave up everything. I was making really good money as a radiation oncologist. It's one of the more lucrative specialties. I did not go into it because of the money. I mean, nobody goes into medicine because of the money, because the medical education is so expensive. I had huge debt coming out. It was because it was what I wanted to do. I wanted to care for people with cancer. But when it became clear to me that this wasn't the way to truly heal, then I basically gave up everything. I gave up that lucrative career. I basically ended up getting a divorce because my husband could not wrap his head around this idea of me like just leaving a lucrative career and having no backup plan for like what that was going to look like of starting this new practice. And so for me, it was a rough transition, but I will say absolutely you can make a living really helping people. It's not going to make a gazillion dollars for, anyone, the pharmaceutical companies especially, but you can support yourself. I now am supporting myself through this new practice. But the other thing is the system doesn't want doctors like myself out there explaining that you can cure cancer without chemotherapy or radiation. And frankly, that's what I'm doing in my practice. I'm having people get rid of cancer without doing any of those toxic treatments. So you become a target, to be honest. And so that's one of the things, to just be, have your eyes open and just recognizing that there's a machine that wants to perpetuate the story that, cancer is caused by DNA damage and that you need toxic treatments to treat that. But that's not true. I don't believe that the story that's been told, and actually I think the mechanism for cancer that is being taught in the textbooks is incorrect. It's not caused by DNA damage. The DNA damage is actually a result of the metabolic dysfunction that we have. So it's interesting that you say, that you're not going to be taught these things in the textbooks. But my question is why? Like, that's my question. Why? Like, we spend hundreds of thousands of dollars in medical school to get this education because we want to help and heal people. Why are we not taught these things? That's to me what's like mind-boggling. And that's ultimately why I had to, make the decisions that I did, because I've spent so much time around death in my career as an oncologist. I knew what people say when they get to the end of their life, and that they say, I wish that I had the courage to be authentic and true to what I knew was true. And so I knew that if I kept just in my job because, it was secure, it was doing, good work, but I knew that it wasn't true, that when I got to the end of my life, that I would question and I would be regretful for how I lived it. And that's ultimately why I had to make the decisions that I make. And I want to be clear that I'm not saying becoming a doctor or working in Western medicine is wrong, but I think it's important as medical students for you guys to have your eyes open, that you're being indoctrinated into a system that is teaching you specific things because there's an agenda, to make money for the system, and just having your eyes open so that when you have the opportunities to help your patients in real ways to eradicate disease that doesn't require them to be on medications forever, that you're doing that.
Yeah, honestly, I think you've done a great job at it, and I'm glad that you took that step forward because it takes one person to get a lot of other people kind of on the bandwagon and starting to take those initiatives themselves. So like through all of your services, I've seen like your Born to Heal podcast and things like that. I just wanted to ask, what like inspired you to go that extra step? How did you come up with sort of all of this plan and outline for how you were going to go about actually making a change?
Yeah, well, actually, that is a really interesting question, because one of the things about becoming a doctor is that you don't really have to think about much. You just get onto this pathway, and then the first step, and it's like, okay, you take the MCAT, and then you pass the MCAT, and then you apply to medical school, and then you're in medical school, and just like, residency. And you have to make little decisions along the way, but for the most part, the whole path is just laid out in front of you. So in some ways, it's really nice because you don't have to think. You get on there, and as long as you're going to work hard, you're going to become a doctor. When I left, there was no roadmap. I had no idea what this was going to look like. And so that was the scariest part of all of this, was that I just needed to start, and also I didn't know what my practice was going to become because I was still learning and exploring. I had obviously deep knowledge. So 20 years being in oncology, I knew a lot and I could help people in many ways, but I had no idea what this new route, how it was going to all come together. And so I had to really live with the discomfort of not knowing what it looked like and just starting, and this is one thing that I think in medicine doctors are not very good at, because we're so used to having like a clear pathway, that when you are set out and it's like you can really do anything, but it's like you've got to make a living and you've got to make this work. It's not clear how to do that. But some of the things for me from my background is that, number one, I believed in myself. Like I knew you have to have very strong convictions to do what I did, right? So I left and I was like, I knew that I could do better than what I had been doing. So I believed in myself, first of all. But then the second thing was that I knew from running very large scale cancer programs that whatever I did, if I succeeded and I was effective, I needed to be able to scale. Like I needed to be able to serve more than just, the few people who could see me just as a one person. And so the podcast is part of that. It's like a scalable way to serve more people. And I chose to use my podcast as like a journey. So on the podcast, I share the things that I wish I had been taught in medical school. And I bring on guests who are teaching me, and then my listeners are coming on that journey. And so I set that up intentionally to be that I was a learner too. Like I'm not the expert. And I think that's actually something that's really important, to have the humility to say, even after 20 years of practicing, I'm like, I don't know everything. I am learning. And so having that openness and doing the podcast in that way, where I was like, look, I'm going to bring you guys along on this journey of learning the things that I should have been taught a long time ago, and I wasn't. And then in terms of my practice, I just started, and then it was like really little. And then now I'm booked, and now I've got a wait list. And now I'm looking at, okay, how do I scale what I'm doing so that I can serve more people? And then also so that I can train other doctors and other nurses and people in my method, so that this can scale and more people can be helped. But that's because I had that mindset of being a leader at a high level and really doing scalable programs, and also an inventor. I'm always thinking like, it's not just about me carving out a way to support myself. It's really like, how do I create something that's going to make an impact so that more people can be helped?
Yeah, I think you completely hit the nail on the head, right, with your description of how the medical system kind of just sets you up for everything. And so that's why your path is really intriguing almost, and really interesting. And I love to see you having succeeded, like honestly, with your scaling and like having achieved a podcast host. And so I just had one more question about that, and then we can also get everyone else's voices and questions into this. So I just want to ask how you kind of manage all of it. So I know you obviously have drive and you have motivation to actually have impact within the world, but how do you kind of just work everything together so it ends up being a cohesive, actual, impactful project?
Yeah, well, I have a team. So, and that was one thing that was part of the whole scaling thing, that like I knew that I was going to need help. And I knew that I was going to have to invest in myself, kind of like when you guys are paying, you're taking out student loans, you're investing in your education for your future. When I started this practice, I knew that I had to invest in it so that it could become something that would be impactful and scalable. And so I have a team now of 8 people, including a podcast editor and a copywriter, and I have a practice director. And then I also have help at home. Now I'm in the process of looking for someone. But I realize, like, and you guys also as professionals, you need help to do the other things. Like, one of the things that's really important for me is if I'm teaching people how to take care of themselves, I need to be taking care of myself. So I have an assistant who can help come make sure that there's healthy food. They can go grocery shopping and do the things around my house so that I can eat good food and be prepared and ready for my clients. And so I think this is one of the things that we always should be thinking about, is that you want to hire people to do the things that that someone else can do, because you want to be operating at your highest level of scope, right? So we think about scope in the hospital, they'll talk about like nurses functioning up to the highest level of their scope, and doctors as well. Like, you as a doctor won't do the things that a medical assistant can do, because that makes no sense to use your expertise in that way. So my whole business I've approached in that way, looking at my life. How do I get the help that I need so that I can stay in this level of creating and being a visionary about what's possible for healing?
Yeah, so I love how you're not just a singular force and you kind of have this overall collaborative theme that's really commendable with your patient to doctor relationships and sort of the personal take that you take on it, and also with obviously your team. So if anyone also wants to chime in and put some questions in the chat or just ask directly, you can go ahead.
Yeah.
Yeah, I was curious, Katie, can you repeat the statistic on when people believe they'll get better, they get better, or maybe it was a
The
placebo? I'm
placebo
not sure.
effect. Yeah, so the placebo effect, there's a book, I think it's oh, why am I blanking on his name at the moment? It's called You Are the Placebo. It'll come to me in a second. I can't believe that I can't remember his name. But basically, it presents all the data, and the placebo effect. It ranges the percentage of people that are helped with taking a placebo, but it can be anywhere up to 30% of the people who take the placebo can actually have the desired effect of the drug without receiving the drug. Joe Dispenza. That's the author of the book.
Okay. Yeah, and I feel like there isn't, I mean, you've touched on the fact that there's a lot of things in Western medicine that we don't teach or encourage, like diet, internal medicine, that kind of thing. Um, But I feel like there's also not emphasis on mental health, like with the placebo effect. Obviously, if you believe you're going to get better and really like will it to happen, you have a higher result. So I'm wondering if that's something that you include in your comprehensive practice.
Oh, absolutely. The power of mind is a big part of my practice, um, and that's slightly different though than mental health, which I actually want to touch on. So I'm going to come back to that. But one of the things that people don't know, and actually Joe Dispenza is a great person to read about this, is our brain. We have the conscious mind, the things that are in our conscious awareness, and then we have the subconscious mind. And what we're taught, and especially in school and in medicine, if we talk about this, we're talking about the conscious mind, the things that we're aware of. But the truth is that our thought, our actions, behaviors, and words, 95% of them are driven by our subconscious programming, not our conscious thoughts. So this is why you can know the right things to do. Like, let's just say, I'm just going to use an example. You know that you want to have a loving partner who treats you well, who, cares for you, is respectful, all of those things. But someone knows that consciously and they're saying that, but then they end up in relationship after relationship of people who just treat them poorly, right? The reason why that happens is because when that person was a child, what was programmed into their subconscious was either seeing, a parent being mistreated or not being loved, not being respected. And our subconscious is programmed between ages 0 and 8, and also with emotionally charged events, which are usually traumas. And so those things that are in your subconscious, if they're contrary to what you want, even if you consciously know, this is what I want, you're going to sabotage yourself every day. And so it's not just having the conscious awareness, it's aligning both the conscious and the subconscious mind is very important to get the results that you want. And a lot of the work that I do with my clients now is helping them align their subconscious, because they know consciously what they want. They know the right things to do, but they're not getting the results that they want because there's disconnect. And they're basically running these patterns that are counter to what they're trying to create. So that's the piece about the mind. But then the second piece that you talked about mental health, this is really important for you guys as medical students. The rate of physician suicide is very high. It's among one of the highest professions of suicide, and they don't talk about this. But part of the problem is that you are put into a system, the incentives are driven by seeing a productivity, like see the most number of people that you can in the least amount of time, and then you've got all this documentation. The life of a physician is hard. It's really hard. And the system is, even the physicians who really want to make changes and start, advocating, it's like hitting your head against a wall. And even though they talk about wellness programs, like we're doing wellness programs for our physicians and we're giving them access to yoga, no one bothers to say no one has time to do yoga when they're a doctor and they're, busy training and doing all this stuff. But it's like, we're not dealing with the underlying problems, which is, and actually two things here. One is that you guys are not trained how to take care of yourself. Medical training actually teaches you how to treat yourself poorly. You're eating out of vending machines, you're eating at all hours of night, you're not sleeping. I don't know what it's like. I was working before the 80-hour work week in medical school and residency, so it was crazy. But we are not taught actually good self-care. And that, then basically we're, teaching that to our patients as well. But this takes a toll on you, and it's really hard to live within the confines of a traditional medical practice, that you're not in control of, like in a hospital, and keep your mental well-being where it should be, because there's just the pressures are misaligned, or incentives are misaligned.
Yeah, I think mental health issues really do have to be addressed a lot more. And that definitely, especially with the route that we're all going into, that we should take better care of ourselves and such. And I know that that's a big part of your conscious oncology campaign. So I also wanted to ask if you actually have integrate other professionals within the field, like psychiatrists or some sort of therapy,
Yeah,
and
so
recommend that to your patients.
yeah, I don't have other doctors in my practice, although I am now talking to some doctors. But the interesting thing is the ones that I'm collaborating with are ones who are trained to get people off medications. So I'm collaborating with some holistic doctors to help clients get off specific medications that I'm not trained in. So thyroid is an example, or, blood pressure medications, that kind of thing. But I do have other professionals that are incorporated into my practice, and basically hypnosis. And then Psych K is a technique that I use a lot with my clients. It's basically a modality that does three things. Number one, it helps teach people how to become fluent with their emotions. It helps release past trauma, and then it also helps program the subconscious mind. So it's kind of doing multiple things at once. It's helping with the emotional issues, and then it's also helping with the subconscious, and potentially, you know, or not potentially, basically rewriting the subconscious programming that's in place for someone. And basically, with the subconscious mind, you can reprogram it. And so that's what we work on. So I have those practitioners, and then nutritionists, so working with nutritionist, and also for movement. Right now I'm doing a lot of those roles, but my goal is, and I'm now in, talks with developing a team, so it'll be a multidisciplinary approach, but obviously very different than a multidisciplinary approach where it's like, other MDs. I'm looking at these other modalities of how I bring them into my practice.
I had a very quick question. I'm just wondering, when you kind of touched on the whole, I guess people like when you lost everything, when you kind of switched to like this away from Western medicine, and then when you kind of went into like mental health and how we're taught to like eat out of vending machines, I guess that kind of related back to, I mean, I'm not in med school yet, but like for undergrad, how people like, I guess, praise like staying up all night or pulling all-nighters to study and stuff like that. So I guess that kind of ties back when you did leave the Western world and all of these, I guess, bad habits. How did you deal with the self-doubt that you probably had when everyone else is doing something different from you?
Oh, yeah, that's a great question. So, I mean, my self-doubt was huge because I was like, the whole system is saying it's like this. And then I'm like, here, like, nope, that's not it. And all I knew though was that I couldn't do it anymore. And so for me, I had, and I always, I kind of envied people who had such conviction that they were willing to die for what they believed. There's people in history that they're like, I believe this so strongly that like I'd be willing to like be burned because this is my belief. I always thought like, gosh, I wish I was so convicted about something because I never felt that way until this happened. And I think for me, the thing is because I had all this experience of being around people who were dying and I knew what they said, I wasn't going to be that person. Like I knew I couldn't waste my life. And so for me, I mean, still to this day, I like have self-doubt. I'm like, I don't know, but I'm more comfortable now in the not knowing because now I'm like, oh, actually the people who are still in the practice really don't know what's going on. At least I'm starting to ask the questions to see what might be correct. And so for me, it's just, I constantly have to remind myself like it's okay to not know. It's okay not to have a clear path. And you still are going to go and you're going to still walk through it and you're going to do it. And like, I think this is also the other thing for me. This is just a personality trait for me throughout my life is I've always done things that I was afraid of. And that has always served me. So if something scares me, I take that as a sign that I'm on the right path. And everything that I've achieved in my life that has been of consequence and been worthwhile has been something that has stretched me to the point of being uncomfortable. Like we don't grow and we don't achieve great things when we're in our comfort zone. And so I'm constantly, if I'm uncomfortable, I'm like, okay, well, number one, is it dangerous? Make sure I'm not doing something that's dangerous and I'm not going to hurt myself or someone else. But if it's just because it's uncomfortable being alone and by myself, I'm like, okay, well, you know what? This is your chance to practice being uncomfortable. And then what happens though is you start to develop your circle, right? So now I'm in a completely different circle. But because I was willing to speak up, because I was willing to stand up for something that was different, now I'm in a circle of people who think amazing. Like I'm in the circle, I have thought leaders who are now my friends that I can ask questions about. I would have never ended up in that circle if I hadn't taken the risk myself. Does that
Yeah,
answer your question?
completely. That's very well said. And honestly, very reassuring when you said the whole, if you're scared, you're probably doing something right. So
Yeah.
yeah, that's very good to hear. Also, your dog is adorable in the background.
Oh, thank you. That's Asher.
Okay, does anyone have any other questions? Okay, well, we would like to thank you so much for taking time out of your very busy schedule to come and talk to us. It will definitely help a lot of people. If not now, we are recording and posting it to our YouTube where there will definitely be a lot more coverage. So we really appreciate you putting your perspective out there and coming and speaking to us. It was very insightful.
Thank you for having me. It's my pleasure.
Yeah.
And and the thing is this is that I love that you guys are bringing on someone like myself, right? Because I wish that I had heard some of these things when I was younger, because the truth is, I don't know that I would change it. Like, there is power in my credentials and the path that I took. But if I knew it earlier, I would be looking to see, okay, what can I do to use my credentials for good and to really make the most of all the hard work that you guys are putting into your career. And the other thing is, a book that might be helpful for you guys or to look up is Casey Means. She has a book called Good Energy, but Casey Means she was a surgeon who was at Stanford, and she left in her last year of residency because she saw the same thing. And she's out there very vocal. So you can see her interviews. This is like another person who's out there vocally saying, okay, this system, there's something wrong here. And not to say not to be part of it, but just to be aware so that way you guys can be smart about how you design your career and take what you want, and then leave some of the stuff that maybe not so helpful behind. So I wish all of you guys the best with your careers and your schooling and all of that.
Yeah, no, thank you so much. It honestly opened up such a new perspective that I don't think any of us get exposure to enough, to be honest. So it was really good and very eye-opening. So yeah, it has been hours, so we will let you go.
Perfect.
But yeah, thank you so much, and I really hope you have a good rest of your day.
You too. All right, thank you so much.
Thank
Bye bye.
you. Bye.